As we honor the dynamic visionary and leader, Dr. Anthony Parker, and his life and legacy, we reflect on the countless individuals he impacted and the unforgettable effect he had on his community.
He was a visionary leader that thought years ahead. It wasn't next month, next week, next year. What's the next 5, 10 years is going to look like? What are we going to need? And let's start planning for that now.
When he spoke, it was because he had a genuine input that needed to be said. Just a good guy, and we lost a good one.
He drew you in. You'd think he was maybe mad or a bit grumpy, but then he'd flash this big smile and this big hearty laugh, and it could almost be magical.
Dr. Parker served on the Phoebe Putney Memorial Health Board of Directors from 2004 to 2008 and was a member of the Phoebe Putney Health System Board from 2009 until his death in 2022. He was the longest-serving president in the Technical College system of Georgia and transformed Albany Technical College, or ATC, from a small vocational school to a thriving regional college that has improved thousands of lives in Southwest Georgia by making superior technical education accessible to those who otherwise might not have had an easy path to higher education.
I would guess we had 5 or 6 different areas of expertise when he came here, and there's probably 50 now. Many of those students would not have attended higher education beyond high school had it not been right here.
Whether that be in healthcare, whether that be a diesel mechanic, a truck driver, an EMT, he just wanted to make sure that people were able to experience their full potential.
Not only did Dr. Parker help make education accessible, he was always looking for ways to ensure the healthcare programs at ATC continued to grow. In 2000, ATC opened the Nathaniel Cross Health Technology Building, and Dr. Parker continued to build on this transformative project through the years. In 2008, ATC opened the Charles B. Gillespie First Responders Building and completed a $350,000 renovation of the nursing lab in the Nathaniel Cross Building. In 2016, ATC further enhanced its healthcare educational offerings with the establishment of an Associate of Nursing program. Dr. Parker was instrumental in each of these transformations.
He saw the need that more RN nurses will be needed in the future, not only for this region, but in the nation. He put together a plan to develop that program. It has blossomed to one of the top programs in the state of Georgia.
Dr. Parker also worked to make sure ATC students successfully graduated and assisted them in finding local employment. Whether working as EMTs in the community or fulfilling essential nursing and tech jobs at the hospital, Dr. Parker helped boost the community's healthcare workforce at a time when the entire country is struggling with the same issue.
You know, they said, well, we don't have that much in the budget. We can't do that. We don't have the money. And then he would go get the money. It was a win-win because that's exactly what the technical system wants to do. And of course, what the community needed. And he was just the right person for the job.
He was a chance taker. He wasn't irresponsible, but when he had the chance to hit a golf ball and to, cut a corner or to do something, he went for it. And I think that's how he lived his life.
His goals were huge, and he expected his team to think large and huge as well, and he had the right people in place to implement those particular goals.
I called Dr. Parker a year ago and said, I don't think we have enough. He said back to me, let's go big, Scott.
Dr. Parker was a strong proponent of the Phoebe Health Sciences Pathway, an innovative educational partnership between Phoebe Putney Health System, Commodore Conyers College, and Career Academy, or 4C Academy, and Albany State University. It allows 4C students to dual enroll in ATC while still in high school. They have the opportunity to complete their core college classes at no cost, earn their nurse assistant certification, and apply for a paid internship position at Phoebe, all while still in high school. Upon graduation, they can immediately go into the nursing program at either ATC or Albany State, getting a head start on their professional training and education so they can enter the workforce earlier.
He could see the future, but he knew what to do in the moment. And that moment, we went from 40 nursing students at Albany Tech to more than 200 with this plan of developing a living and learning center. And we were off to the races.
While working to bolster the workforce pipeline, Dr. Parker was also busy touting the extraordinary care available at Phoebe. As a cancer survivor, he led efforts to raise awareness about cancer prevention and money to help cancer patients in the area. He spoke forcefully and gracefully about the outstanding care he received at the Phoebe Cancer Center and was a strong patient advocate, always encouraging Phoebe to continue its investments in cancer care so the people of Southwest Georgia have access to exceptional cancer treatment without leaving home.
Dr. Parker was never one to seek acknowledgement, seek recognition, seek accolades for what he did. He was just a doer. And so if he could look in over his own accomplishments, he would be impressed and amazed and pleased, because I don't know that he fully realized what he did accomplish.
When Dr. Parker walked in the room and when he said something, people listened. He just didn't talk to talk. He was trying to make an impact.
He wanted to make sure that I remembered everything that he talked about, what we need to do in this community.
He was trying to love on his family, people in this hospital, or the community.
You know, you meet a lot of people along the way, and he's one of those that is impressive because he was so genuine.
If I could see Dr. Parker today, I would tell him I miss him and to rest well.
He did it so well. We miss it immensely, but we feel lucky to have had it for as long as we did.